Sheldon Miller from Chicago, former chair of psychiatry at Northwestern University Medical School. Okay, what drew me to addiction psychiatry is probably not quite the right question, because there was no addiction psychiatry at that point in time. What drew me to addictions was an experience of living on the Navajo Indian Reservation and seeing the epidemiology, which was an immense problem, and dealing with a disorder that in the early 70s we had no idea how to deal with. We really didn't have any good treatments. We were working in a different culture. We were in a situation where what used to work in the dominant culture simply didn't work in this culture. AA was not part of the armamentarium because the ethic at that time was you don't share personal feelings in public. So I was sitting there with about half the patients I was seeing having a disease I didn't know very much about, and working with the tribe to do something for these folks, and realizing we just didn't know enough to do a whole lot. So there's two ways to handle that. One is to run and say, I'll never see this again. Or two is to take it on and say, okay, let's learn something. Let's try to do something.
Great.
And I decided the latter was much more fun than the former.